Welcome to UITM Clinical Skills Program. This is Clinical Station 3, Intravenous Cannulation. In this video, you will learn the correct technique of inserting an intravenous cannula. Before beginning, make sure that you have prepared all the equipment required, including the alcohol swab, intravenous cannula, and saline flush. Please ensure that your hands are washed and gloved as well. Position the patient's arm in a comfortable extended position that provides adequate exposure of the planned area for cannulation. Inspect the area for a suitable vein. It should ideally be visible without applying the tourniquet. Apply the tourniquet at least 4 to 5 finger widths above the planned puncture site. Palpate the vein that you have identified earlier. It should be filled up and more prominent after applying the tourniquet. Clean the site with an alcohol swab and allow it to dry. Do not touch the cleaned site afterwards at any point, otherwise the cleaning procedure will need to be repeated. Insert the cannula directly above the vein through the skin at an angle of 10 to 30 degrees, with the bevel facing upwards. You may need to stretch the skin slightly. Observe for flashback of blood in the cannula chamber as you advance the cannula. Once you see the flashback, stop and withdraw the introducer slightly. Then, carefully advance the cannula into the vein fully. Next, release the tourniquet. Apply pressure to the proximal vein, close to the tip of the cannula to reduce bleeding as you gently withdraw the introducer needle completely. Take care that you do not dislodge the cannula. Connect a primed syringe and dispose of the introducer into a clinical waste bin. Inject the saline into the cannula using the flush you prepared earlier. It should go in smoothly with little resistance. Watch for signs of swelling around the site. Stop immediately if you see this. If the patient complains of pain, you should also stop immediately. Once you have ascertained that the cannula is functioning properly, close the cannula port with a stopper or spigot. Finally, secure the cannula properly with a dressing or plasters. At the end of the procedure, dispose of the used items and clinical waste into the appropriate bin and wash your hands. To supplement your learning, please go to our CSL platform to download materials related to this station. You are also encouraged to view this video again in our CSL platform to help you with your practice sessions.